Thank you for choosing SSM Health for your joint replacement surgery, and welcome to the online version of our class, Preparing You for Total Hip Replacement or Total Knee Replacement Surgery. Some of our objectives of this presentation are to review arthritis and treatments, review knee and hip anatomy, to review knee and hip replacement surgeries, to review preparation for surgery and discharge from hospital, and to review physical therapy exercises and precautions. We will start by reviewing some basic anatomy, and we will start by talking about the knee. Compared to other joints, the knee joint is a pretty simple joint. It is comprised of three bones: the femur, or the thigh bone, the tibia, which is the main weight-bearing bone that extends from the knee to the ankle, and the patella, or the kneecap. There are two types of cartilage in the knee. The first is the meniscus, and that is the cushion between the bones. The second type of cartilage is the articular cartilage. This type of cartilage covers the end of the bone surfaces. There are 4 ligaments in the knee, 1 on each side and 2 that cross in the middle, and 3 muscle groups that allow your knee to bend and move in the way that it should to function properly. The one in the front is the quadricep, and you have 2 in the back, the hamstrings and the gastroc, which is also known as the calf muscle. The hip is a ball and socket joint and also one of the largest weight-bearing joints in your body. The ball of the hip is also known as the femoral head, and it is at the top of your thigh bone, and the socket, which is also known as the acetabulum, which is the part of your pelvis that the ball of the femur articulates with. The hip capsule is made up of bands of ligaments that help stabilize the joint, an articular cartilage that covers surfaces of the bone's ends. Next, we are going to review the basics of arthritis. By definition, arthritis is a destruction of articular cartilage. There are several different types of arthritis. 95% is osteoarthritis or degenerative joint disease. There are some small percentages of post-traumatic or rheumatoid that can also cause you to be in need of a joint replacement. Some symptoms of arthritis is pain, joint swelling with warmth, and over time you can develop a deformity. This is an X-ray of a normal knee. And what I mean by normal is that you can see between the femur and the tibia there is a nice dark line. This means this person has adequate amount of cartilage. Also, when you look at the outline of the femur, everything is nice and smooth. Also, the femur lines up directly over the tibia, so everything is in good alignment. This is an X-ray of someone with severe arthritis. As you can see, that nice dark line is gone. This person has bone-on-bone arthritis. Over time, you can develop bone spurs, which can be really painful. Because it's bone-on-bone, you can have bone destruction, which can also be very painful and can cause an angular deformity in the knee joint. And here they are in a side-by-side comparison, which makes it easy to see the difference between the two. This is an X-ray of a normal hip. Again, just to review the anatomy, you can see the head of the femur and you can see the pelvis. The nice dark line between the two means that this person has adequate cartilage in their hip joint. The outline of the head of the femur is nice and smooth, and the hip is normal alignment. As compared to this X-ray, in this X-ray you can see that the nice dark line in between the head of the femur and the pelvis is gone. This means this person does not have adequate cartilage in their hip joint. And when you look at the outline in the head of the femur, you can barely tell where it ends and the pelvis begins. Over time, this causes bone destruction and can eventually end in an angular deformity of the hip joint. And here they are in a side-by-side comparison. You can easily tell the difference between the two. As far as treatment for arthritis goes, we start with the easy things first, and surgery is considered when the non-operative management fails. Some of the things we think about in regards to conservative treatment are the use of medications. A lot of times, the doctor will start with an anti-inflammatory medication. You can even start taking an anti-inflammatory medication prior to seeking treatment from a doctor. The prescription anti-inflammatory medications, however, are stronger and longer acting than the medications that you take over the counter. Many people also try corticosteroid injections. These are a gold standard treatment for arthritis. They are great because they are single injections that you can get in the office and walk away feeling pretty good after the injection. But over time, with both of these, and as the arthritis progresses, they become less and less effective. That is when surgery is considered. Having surgery is a very big decision and it requires a lot of thought and a lot of planning. It's not a decision that can be made based on an x-ray. It's not a decision that the doctor can make for you. You have to make that decision, and generally it's based on your quality of life. When you're not able to go out and enjoy the things you do and the arthritis interferes with your day-to-day activities, that's when most people are considering joint replacement surgery. First, we are going to talk about a knee replacement. We don't really like to call it a replacement, but we like to refer to it as a knee resurfacing. The doctor will go in and remove the worn cartilage and bone and resurface the knee with metal and plastic components. There are more than 900,000 knee replacements every year in the United States. Again, it is a resurfacing of the entire knee. The surgeon places a metal cover over the end of the femur and a metal and plastic component on the top of the tibia. A lot of times when you have arthritis in the knee, you will also have it on the underside of the patella. In this case, the doctor will go in and clean out the arthritis from the underside of the patella and place a plastic button on the underneath so that everything articulates well and moves smoothly together. Knee replacements can be used to correct the major deformities that we discussed earlier. It can also be used in rheumatoid and traumatic arthritis. 9 out of 10 knee replacements will last beyond 15 years. In these images, you can see the one on the left is the one I previously showed you with the arthritic knee. In the middle and on the right is what the knee replacement looks like on x-ray. Next, we are going to talk about uni-knee, or partial knee replacement. With this surgery, patients need to meet a specific criteria. They must have osteoarthritis and an intact ligament on the front of the knee, or an intact ACL. It's usually only indicated for patients that have medial or inside knee arthritis. A uni-knee prosthesis is approximately 1/3 of the size of the total knee prosthesis. The 3 to 4 inch incision allows for shorter hospitalization time and shorter recovery time. The image on the left shows what a patient looks like who has medial arthritis in their knee. The image on the right shows what a uni-knee looks like after surgery. Now we are going to talk about total hip replacement. There are more than 450,000 hip replacements performed in the United States. The diseased ball is replaced using a metal or ceramic ball and a metal stem inserted into the thigh bone. There is an artificial cup placed into the acetabulum. Again, just like with the knee, it can be used to correct those deformities and can be used in patients that have rheumatoid arthritis or traumatic injury. 9 out of 10 hip replacements will last way beyond 15 years. In this image, you can see the hip arthritis on the left, just like the image I showed you earlier. And on the right, you can see what the hip replacement parts look like after surgery. All of our surgeons do perform some form of minimally invasive surgery. This minimally invasive technique minimizes ligaments and tissue damage during the surgery. The surgeon avoids cutting through some of the large muscle groups around the joint, and this allows a patient a more rapid recovery and return to activities of daily living. More than 90% of patients will get rid of 90% of their pain after these procedures. This allows patients return of their joint motion and return of their activities. Surgeries do not come without some risks and complications. The 6 you see on the screen we are going to review individually. Infection prevention is a big thing on everyone's mind when they are contemplating surgery. The hospital does its job to prevent infection, and you also help with that. The things that the hospital does to prevent infection are using a special surgical soap at the surgical site. Also, all our rooms are private rooms when possible so that you are not sharing a room with other people. Also, antibiotics will be given as directed by your surgeon. How you can prevent infection. You will be directed on how to use chlorhexidine, which is a special type of soap that you will shower with the night before and the morning of your surgery. Please remember not to touch or pick at your dressing. Follow all wound care instructions given to you at discharge. Please remember to use proper hand washing. Hand washing is the number one best way to prevent infection. Please remember to use proper hand washing after toileting, after blowing your nose, and before eating. Please do not allow pets near your surgical site. This can create additional risk. After your surgery, you will be given directions on using antibiotics before any invasive dental work. These antibiotics will be directed by your surgeon. Another risk of surgery are blood clots. Blood clots can be prevented in 3 ways: exercise, medication, and a device called sequentials. Exercise is the number one best way to prevent a blood clot from developing, and you will be instructed on what type of exercises are best for blood clot prevention. Medication will also be prescribed for blood clot prevention, and you will take medication at home also. Sequentials are a device that will be used at the hospital. This consists of a pump at the end of your bed and sleeves that are wrapped around the lower portion of your legs that inflate and deflate, pushing the blood back up towards the heart, preventing it from pooling in the deep veins of the lower leg. Blood loss is another risk after surgery, but very few patients will require blood replacement after total joint arthroplasty. Hip dislocation for a patient having total hip replacements is very rare. Less than 1% of patients will have hip dislocation after surgery. Depending on your surgeon and their surgical technique will depend on some instructions you will be given in the hospital on some necessary precautions to follow in the hospital and at home. One of the big problems that we see after patients are discharged from the hospital is constipation. So constipation prevention is very important. Some things to consider regarding constipation are to try to resolve any issues that you have with constipation prior to surgery. If that means that you have to take an over-the-counter laxative in preparation for surgery, that is okay. Also, starting now, whether your surgery is tomorrow or not even scheduled, we would like you to get into a better regimen of water drinking. At a minimum, our bodies need 8 ounces of water a day. So try as best you can to increase the amount of water you are taking in. Also, try to choose foods that are higher in fiber, especially fresh fruits and vegetables. If you need to use an over-the-counter medication for constipation, the ones we recommend are Miralax, Senna, or milk of magnesia. Do not use bulk laxatives such as Metamucil. For narcotic-induced constipations, the ones that we recommend are the best. Also, keep in mind, if you have trouble having a bowel movement, a suppository or an enema may be necessary. if the above are not successful. If you have any questions about the specific medications that we recommend, please talk to your pharmacist. Pneumonia prevention is another thing we are concerned about after surgery. Pneumonia is an increased risk because of the anesthesia medicines used and inactivity. Another reason that it is important to get out of bed and try to take a few steps the day of surgery. Another thing that is important to use is the incentive spirometer, and that's the tool you see on the right of the screen. This is an exercise for your lungs, and you will be instructed on how to use this after surgery. It helps expand the lungs and allow your lungs to take a big deep breath. Also, if you are a smoker, it is very important to try to quit smoking prior to surgery. The thing that we worry about the most with cigarettes is the nicotine. Nicotine causes vasoconstriction, and that doesn't allow the nutrients and oxygen that your body needs for healing to travel to the part of your body that needs the healing. This could lead to a high risk of postoperative complications and could lead to a stay in the ICU and an inability for your body to heal your wound and therefore a higher chance of acquiring an infection after surgery. The recommendation is that you stop smoking 4 to 6 weeks prior to surgery. But any amount of time you are able to stop, even if it is just a few days, will be beneficial. We ask you to do so many things in preparation for surgery. And one of the things we ask is that you visit your primary care doctor to obtain medical clearance. The surgeon that is taking care of you wants to know from your primary care doctor that you are well and healthy enough to go ahead and have this surgery. Also, this is important because if there are things we need to work on ahead of time to better prepare your body for surgery, we have time to do these things. Another thing we ask you to do is visit the pre-testing center. You need to do this testing at least 4 weeks before your surgery. At this appointment, you want to bring your insurance card and a picture ID. We also ask that you bring copies of any durable power of attorney for healthcare, healthcare directive, or living will if you have any of these. Bring recent copies of blood tests and EKGs and a list of your current medications. While you are at this appointment, there may need to be additional tests performed. Please do not eat anything after midnight on the day of surgery. While we don't want you to have anything to eat after midnight, you are able to have clear liquids all the way up to 2 hours prior to your arrival at the hospital. The next thing we are going to discuss is nutrition. Nutrition plays a very important role in your surgery and your healing afterward. If you are a patient that is diabetic or your doctor has told you that you are pre-diabetic, it's important to keep your blood sugar under control before and after your surgery. Good nutrition can help maintain lean muscle and strength, improve your recovery time, prevent infection, and reduce the chance of hospital readmission. So starting now and for at least a month after surgery, we want you to follow an anti-inflammatory diet. Within this plan, you are going to get at least 100 grams of protein every day, and we also want you to focus on drinking non-sugary beverages instead of soda, juices, and other drinks that contain a high amount of sugar. Do keep in mind that if you have been diagnosed with chronic kidney disease, an excessive protein diet could be contraindicated. So in this case, we ask that you speak to your primary care doctor to make sure that 100 grams of protein is okay for you. If you have trouble eating protein or don't have much of an appetite, it's a good idea to have a nutrition supplement or a protein supplement on hand. You want to look for protein supplements that are high in protein and less than 300 calories. The ones that you see on the screen are just a small example of what's available. Find something that works for you and that tastes good to you. Something else we ask you to consider in preparation for surgery is choosing a PAL. A pal is an adult family member or friend that can help guide you through your recovery. This person might be available for tasks such as transportation, minor help at home, and getting you back and forth to appointments. This can not only be a physically taxing part of your life, but also emotionally, and we all need someone there for us in our time of need. The next portion of class covers physical therapy. In preparation for surgery, there are some things we would like you to think about in regards to your home environment. First, eliminate obvious hazards such as throw rugs and clutter. Second, add safety modifications such as grab bars, non-slip mats, and night lights. Third, try and measure your doorway and bed height. Bring these measurements with you to the hospital so your therapist can accommodate your home living situation. Keep in mind that pets sometimes do create a fall hazard, so please have a plan for your pets after surgery. When you're thinking about preventing a fall after surgery, you want to prepare your home prior to. Take time when rising from a chair. Always bring your walker with you and wear proper footwear. We would encourage you to wear a shoe that comes around the back of your foot and ankle and not a flip-flop or a loose-fitting shoe. If at all possible, we like your pal to stay the night for the first few nights that you are home from the hospital. This is for safety. Next, we are going to talk about things you can do now, whether your surgery is tomorrow or not even scheduled yet, that will help you be better prepared after surgery. The strengthening exercises that we are going to show you are for patients that are having total knees and total hip replacements. You're going to do these exercises 1 to 2 times a day for 10 repetitions each. And as you can see in capital letters, as tolerated. The goal of these exercises is to get you familiar with them, not to cause more pain prior to your surgery. In the videos we are going to show you, Julie, one of the physical therapy staff members at the Joint Replacement Center, will be talking to you and guiding you through the exercises.
We've put together a video to show you some of the exercises that we'd like you to work on before your surgery. It's a good way to become familiar with them, and you'll also be doing a lot of these after your surgery. We'd like you to perform these exercises 1 to 2 times a day for 10 repetitions. Try to perform them on a bed if you can, because getting up or down from the floor might be very difficult. The patient you'll see in the video actually just had surgery 2 days ago, and he's doing very well. Some things that you'll want to remember when you exercise is to perform them slow and controlled. You don't want to perform them with quick, jerky movements. Also, always return your leg to your starting position and relax your muscle tension in between your repetitions. Lastly, make sure you breathe. Don't hold your breath. This exercise is called an ankle pump, and what you'll do is just push your feet back and forth. After surgery, this helps prevent blood clots by increasing lower leg circulation, but we like you to do it before surgery so that you can become familiar. This exercise is called a quad set. What you'll do is roll up a pillow or a towel and put it under your heel like this, giving a gap between the back of the knee and the bed. What you want to do is push the knee down flat towards the bed, and that will tense the thigh muscle that we're trying to strengthen. Push down. So pushing down, and hold it for 5 counts, and then relax. Push down, and relax. This exercise is called the heel slide. What you'll do is bend your unaffected leg up towards you with your foot flat on the bed. Your affected leg, you want to keep your knees and toes pointed upward and try to bend your knee up as far as you can. And slowly back down. exercise is called abduction. What you'll do is keep your leg nice and straight and flat down on the bed. Make sure you keep your toes and your knee upward towards the ceiling. Don't let your leg roll out to the side. With this exercise, you'll push your leg over to the edge of the bed and then back to the middle. Push out. And back. Try again. Push out. This exercise is called a straight leg raise. What you'll do is bend your non-affected leg up towards you where your foot is flat on the bed. On your affected leg, you'll want to keep it locked nice and straight at the knee and try to lift the leg up about 6 inches from the bed. Bring it back down and relax your muscles and go again.
You will be up and moving on the day of surgery. Physical therapy will also clear you to go home safely. They will review fall precautions with you. They will review PAL training with your PAL, and they will go over things like walking, transfers, using the stairs, transferring in and out of the car, and most importantly, exercises. Please remember to bring comfortable clothes for physical therapy. Remember, with knee replacements, you don't want to wear anything too tight around the knee because the therapist will need to measure your knee flexion or bending. If you are having a hip replacement, you want to wear something that is loose around the waist because we will need to be able to view your incision. The physical therapy goals for you are to prepare you to go directly home. Home is a very great place to be after surgery. Most people recover better and faster at home in their own environment. We want you to be able to walk safely with a walker in your home. We want you to be independent with your exercise program, and we want to be able to help you with any equipment needs for home. Most people will only need a wheeled walker when they leave the hospital. Other equipment, such as bathroom equipment, grab bars, and those types of things, are not generally covered by insurance. Your goals are ICE and patients having total knee replacements, elevation. You can look at the picture in the bottom of the screen and get a better idea of what we mean when we say elevation. You can see that this man has had a total knee replacement and his leg is elevated on a ramp of pillows. You can also see the ice pack stretched across the knee. Ice is very important for those having hip replacements as well. But as you can see, it's pretty difficult to elevate your hip. Your goal is also to be involved, communicate, participate, and exercise. We use a team approach for the treatment of pain. Our goal is to control your pain at a tolerable level, meaning we would like you to get through your daily activities. Opioid use before surgery may make pain control more difficult to manage after surgery. We would like you to try to reduce your pre-op opioid intake by 50%. We are going to ask you to rate your pain on a numeric scale of 0 to 10, and everyone feels pain differently. So what is a 5 to me, maybe an 8 to someone else? Knowledge is pain medication. The more you know, the less anxiety or fear you will have, and the better your recovery will go. Some of the things you will use to help control pain are anti-inflammatory medications, opioid medications, cold therapy, positioning, and movement and relaxation techniques. Bringing pictures of your family, listening to music that helps to soothe you, deep breathing, or something like a favorite book to bring to the hospital are things that are going to help relieve your pain. Know that anxiety and fear can cause more pain, whereas calm and movement like therapy and walking equals pain control. Also know that your brain's awareness of pain changes based on your emotions, memories, beliefs, and your environment. And your brain's sensitivity to pain is heightened after surgery. This is normal, and consistent movement reduces your pain over time. This is why we encourage you to get up and move and take short walks and do your exercises to help reduce your pain. Knowledge is power over pain. Your doctor, nurses, and physical therapists can help answer any questions that you have about pain. There are two types of anesthesia used during joint replacement surgery. The first type is general, and the second type is spinal. The type of anesthesia that you will have will depend on your surgeon's preference. The surgery will last anywhere from 1 to 2 hours. During your surgery, your family will be waiting in the family waiting area. The surgeon will come out or call after your surgery is complete and talk to your family to let them know that the surgery is finished and that they have moved you to the recovery room. Generally, a patient is in the recovery room for 1 to 2 hours after their surgery. When you get to your room in the hospital, you will be oriented to the unit, your nurses, and the staff. Do know that the surgeon is going to ask a medical doctor to come see you and follow along in your care while you are at the hospital. If your primary care doctor comes to the hospital that you are at, the primary care doctor will be notified and they will come to see you. If your primary doctor does not come to the hospital, your surgeon will consult a hospitalist to come see you and follow along in your care. Regarding wound care, there are a few different options. You may have a type of dressing called a silver dressing or a Mepilex dressing, or you may have a dressing called a Tegaderm. You can see the two pictured at the bottom of the screen. The one on the right is the Mepilex or silver dressing. The one on the left is the Tegaderm. If you have staples to close your wound, they are going to come out approximately 2 weeks from surgery. They will be removed by a home care nurse or in the physician's office. If dressing changes are needed at home, the home care staff will help with that. You can shower with both of these types of dressings once you're home from the hospital and after your first visit from the home physical therapist. The reason we ask you to wait to shower until you get home is that you are in a more familiar area and you are familiar with your home environment. The home care therapist will show you how to safely get in and out of your shower. Both of these dressings are water resistant. In regards to discharge preparation, patients are normally discharged the next day. If home care is ordered, it will consist of a physical therapist coming to your house 2 to 3 times a week for 2 to 3 weeks after surgery. You will also have a nurse coming out to your house. The nurse makes 1 to 2 visits a week for 2 weeks. Home care will guide you on dressing changes at home. Not everyone will have home care ordered. If you do not, you will be given specific instructions. Remember that feelings of being tired, having a decreased appetite, and differences in sleeping patterns are all normal after surgery, and these things can affect some patients more than others. It's very important to follow the nutrition guidelines we have given you, drink plenty of fluids, and complete your exercises to gain range of motion. In thinking about discharge, we would like you to arrange for your pal or whoever is going to pick you up from the hospital to do that. Please make sure you have a pain prescription for home because getting home from the hospital can be a difficult task. And we will also arrange for physical therapy for 2 to 3 more weeks. You want to follow up with your physician in 2 to 3 weeks after your discharge. For questions or concerns after discharge, we would like you to call your surgeon's office. Anytime you do have questions, please refer to your patient education booklet. This can be very beneficial prior to surgery as well as after. In knee replacement patients, please remember that you should elevate your leg to decrease swelling. You will be given specific instructions on how to do that. Preventing infection at home is a very important part of your recovery process. Please remember to not touch or pick at your dressing. Follow all wound care instructions. If you are instructed to change your dressing, wash your hands thoroughly before and after dressing changes. And as discussed earlier, hand washing is the number one way to prevent infection. So remember to properly wash your hands after using the toilet, blowing your nose, and before eating. Do not allow pets near your surgical site, as this can create a greater risk for infection. Wear clean clothes and wash your bedding frequently. Ask your surgeon if antibiotics should be taken before any invasive dental work after your surgery. Please shower as instructed and no tub baths until cleared by your surgeon. Thank you so much for taking the time today to listen to our presentation. Should you have any questions, please refer to your physician's office.